If it's determined by the ultrasound that you have venous insufficiency, and I'd just like to explain what venous insufficiency is. Venous insufficiency is when the greater saphenous vein in the leg is not returning blood to the heart the way it's supposed to, because either the valves are not working correctly in that vein, or the diameter of the vein is just too big. So the treatment after diagnosis is we do what's called a radiofrequency ablation, and that Alex can explain what that is.
It's a simple procedure that requires ultrasound-guided assistance from the ultrasound tech to assist the physician. But essentially, everything we do here, including the radiofrequency ablation, is endovenously, which just simply means that it gets done through a needle and a catheter that is plugged up to a machine that gives out radiofrequency waves. Essentially, it's heat. You can think of it as a heat probe that goes into the vein. Then we surround your vein with fluid that also involves a lot of anesthesia, so you don't feel absolutely anything. At that point, we ablate. We are closing the vein with that heat probe, causing the vein to collapse, and at the end of the day, your body will absorb it, and the blood will naturally reroute to healthier, deeper veins that you have. It lasts about 30 to 40 minutes, and this includes preparing you for the procedure and post-oping you, which is taking care of you after the procedure. So really, all doctor-no-OB, the time the doctor-no-OB spends with the patient during the procedure is 15 to 20 minutes. So the 30 to 40 is just everything else that we do for the patient's safety.
That depends on what the ultrasound shows, what parts of the greater saphenous vein actually have disease. So the treatment plan can be a long treatment plan to treat this. So we do try really hard to shorten it up for you as much as we can. Most patients are coming to see us for at least 4 weeks, depending on how much disease they have. Some people longer, some people shorter. It really all depends on the ultrasound, how severe the symptoms are and how severe the disease is. What you see on the outside of the legs, whether it be varicose veins, spider veins, that's caused from venous insufficiency most times. It's very rare that you have someone with a bulging varicosity or a lot of spider veins and they don't have venous insufficiency. Could we remove the bulging veins without fixing what's really wrong on the inside of the leg? We could. He doesn't really like to, because they will come back because you haven't fixed the problem. And secondly, that's not the correct medical approach to it. And it's the same thing with sclerotherapy, which is the injecting of the outside veins that most women don't like to see. We always suggest that you have the ultrasound because, again, that's the end result of what's really going on the inside. Now, with spider veins, we do have patients that have come and we've done ultrasounds and they don't have any venous insufficiency. And at that point, he feels comfortable injecting those veins for them as a cosmetic procedure because we've investigated and it's just something that they have. Again, it's very uncommon that we have that. Dr. Nuomi prefer, if you've had the ultrasound and he sees that you have venous insufficiency, he prefer not to even inject those veins because, again, the same thing is going to happen. They're just going to keep coming back.
It's a simple, it's a medication that we turn into foam, and this medication is a saline-based solution that gets injected to your veins that are outside, the spider veins that you physically can see and you do not like. What this does is irritate the little vein inside and cause them to go away, to disappear from the surface of your skin. Again, like you were saying, it can come back, so someone who is only doing cosmetic and only wants that, we can do this every year, but you're gonna at the end be unhappy with the results because you're gonna come back to us in tell us what's going on, why am I getting the spider veins, they're coming back again and again, and this is what we see with a lot of our patients that come just for cosmetic purposes. I got this done 20 years ago, but they're still coming back. So it's something that we see commonly.
As far as insurance covering these procedures, what most people don't know is if you have unsightly spider veins that you don't particularly like on the outside of your leg, and you come to us and you have venous insufficiency, your insurance will pay for those spider veins to be injected once we've completed the treatment to fix the venous insufficiency. So it's no longer cosmetic at that point. It is then considered a medical condition, and insurance will pay for it. Most insurances cover radiofrequency ablation. What we do here to ensure that your insurance will pay for your procedures if you need them, we take your insurance information and we call your insurance company, and we get a confirmation that you are covered under your policy for varicose vein treatment, and we make sure that we give them all the codes. There's nothing other than your deductible if you have one, or your out-of-pocket expenses. If you're covered, we take care of getting the authorization, and there's nothing for the patient really to do.